and welcome to the podcast of Loughborough University's Institute of Advanced Studies, a podcast where our international fellows discuss the most pressing issues of today that we're all facing and share their exciting research ideas. We hope you enjoy today's talk. Thank you for tuning in.
Okay, everyone, I will commence the closing event using the C word of the Business of Women's Health activities. There are a few bits and bobs still ongoing, but in terms of this very intensive week, this is our kind of closing curtain call. We've got a number of people online. I'm looking at the screen, but the owl is what I need to be waving at. For those of you online, thank you very much for joining us. And those in the room, please get up, take more refreshments. There's loads of cakes and sandwiches. Get more coffee, take bathroom breaks, whatever you need. And I think this is going to be about an hour's session. And it's very, very, very interactive, which is my favourite word the past week or so. So rather than sort of introducing any more new content or indeed half an attempt to summarise or reflect on what we've done the past week, we're going to use the next hour with some very special brains that are very tired to talk through the kind of what next. So when I say innovation roadmap, that genuinely is what is next? What are we driving? Where are we heading to? What are some bumps in the road? Where do we need to refuel? Who else needs to be in the vehicle? That's why we're using that terminology. It's a play on the kind of what next and mapping that out. So we've got Hannah in the virtual room who will be convening the messaging. So Hannah will be my virtual discussant. We've got Becky over there, big wave.
Hello, sorry, I was winding
We've got Emma Johnson, big wave from Loughborough Sport. And then Sam is on her way. So I'm going to say our sub for Sam is her dynamic duo person, Kelsey. Kelsey, give us a wave. So as many of us kind of thinking this through, we're not going to get through everything in this next hour, but hopefully there'll be some stimulating thinking, conversation, and most importantly, what next? I'm going to do a very short presentation, very, very short. But in the midst of that, it is mostly to provoke conversations on tables. So you've all got a copy of our Sport Core plan. Google that online if you don't have a copy of that. You've got our Women in Sport Research and Innovation Hub flyer. And then you've got some blank sheets of paper, post-its and pens, and a few bits and bobs from the Rugby World Cup. If you need to get up and move around, we have also still got up for one more hour our exhibition. So just a huge shout out to the academics and the doctoral researchers that provided posters, to the School of Design and Creative Arts that provided some student projects from their degree show this past year, to Loughborough Lightning for providing us / me giving away a couple of bits from Loughborough Lightning, and a few bits and bobs from other sources. So just a huge thank you. But if you need to get up and walk around and engage with all of that, that's also fine. I'm going to keep this very short. But why are we here? What have we done so far this summer? What have we done so far in this past week or so? So this summer, kind of need to blame Naga and Jeanette in that photograph. The BBC have named this summer the Summer of Women's Sport in the UK. Emma and I were given about 4 days' notice to go down to the stadium at Loughborough, where there was a national radio programme with 50 of the most influential women in sport voices. Emma sat next to Sally Gunnell and Catherine Granger. Yeah, don't get much bigger than that. And that kind of kicked off this, the context of this Summer of Women's Sport. So some of this for us was reactionary, but some of this we already had in the planning because of the launch of the Hub, which is led from an R&I perspective by Dr. Emma Pullen, who's also in the corner, I think working on a bid as we speak. So we've kind of put together what an innovation roadmap survey, which I'll come on to. We've done a series of podcasts as part of Martin Foster's Expert in Sport podcast series. One is going out tomorrow on parasport and gender equity. So we've managed to get World Wheelchair Rugby and Great Britain Wheelchair Rugby to speak with us about that. We did a really lovely summit last week. We've attended a series of the rugby games. I'm really grateful for Deirdre for coming to all of those with us. And then this past couple of days, we've worked with the Institute of Advanced Studies on this spotlight on women in sport. So we've not covered everything, but we've certainly tried to involve people in different ways so far this summer. There are more events. I'm not going to go through these item by item. I'll sort of highlight two that are very important for me. One is the National Centre for Exercise Medicine public lecture, Tackling the Gap, Medical Equity and the Women's Game. That is on the 24th of September in the National Centre, but it is also hybrid with Dr. Karen Jones from the England Rugby and Gloucester Rugby. And then in July next year, I probably will need to have a rest between now and July, where we will be hosting at Loughborough University the Women in Sport Exercise and Academic Network. So stuff that you are talking to us about today and in groups, we'll go into what our call for papers will look like, what some of our format will look like for that conference. So we're super grateful that so many of you have joined us today. Okay, small presentation. Why the business of women's health? We met with rugby, the Royal Rugby, but some people from rugby, at the end of last summer, and they set us at Loughborough University a challenge and started to have conversations with us about three things. How, as a university, can you encourage collaboration and partnership? How can you use research and innovation to empower and galvanise? And what is the role of a university in convening and connecting? So what I'm going to do is walk you through each of these three things in the next set of slides and how our interpretation led to the Business of Health Summit and why we're sat here today. Firstly, collaborate and partner. England Rugby, Rugby Football Union convened a group of academics and leading voices from rugby in the autumn last year to put a spotlight on health and well-being for women in sport. And I'll let you read the quote that Karen said that was put into the press release. So off the back of this, and again, this is a publicly available webpage, Rugby published a spotlight on health and well-being for women in sport, and there's a series of commitments that they've made as an organisation. So we pulled those commitments and we started to think through what do we do at Loughborough that aligns with those, and that's where we started to think about how we could directly collaborate rather than taking on all of the commitments or everything rugby was wanting to focus on. The second component around partnering with rugby has been the Women's Rugby World Cup. If you aren't aware that it's currently happening, you possibly might be in the wrong room today. And I'll just let you read the quote that Alex gave to us in a podcast we recorded with her a few weeks ago. And in the first line, when it says, how can we really make it is the Women's Rugby World Cup this year. So this Elevates, that's sort of a biggie, became an initiative that Alex and others at Rugby were driving, and a number of academics, a number of sponsors, a number of community partners have been involved in that. And I think, don't quote me on this, there were 81 initiatives put on the table for Elevate. And off of that, that group have kind of focused on a number of them. They've not tried to take on all 81, but the summit was part of that activation of this sort of Elevate programme. So that's how we've kind of tried to collaborate and partner in this space. The second thing is to empower and galvanise. So we knew that we needed to be multidisciplinary. We wanted to be multi-sites, because if you look on the Northampton flyer, there's been a lot of games with the Rugby World Cup down in Northampton, which is about 60 minutes that way. We wanted not to cover everything, so we leaned into three topic areas that we're particularly good at here at Loughborough: sport technology, sport science, sport events. And then we tasked our speakers with being solution focused. So for example, Professor Deirdre McGee, you've been challenged a lot the past week to speak in different types and ways. And everything kind of has been in that vein of being solution focused rather than a traditional academic paper or a traditional sort of conference proceeding, which we're very grateful for. And it's enveloped sort of three things. What are the business sides of all of those? What are the women and girls sides? And what are some of the health sides? And then finally, we've tried to convene and connect as much as possible. And this is a diagram where I'm not going to go into exactly how many people we invited and who, but we have tried at every vector of organising this to be multi-sector. So policy and public partners, for example, the Department for Culture, Media and Sport. We have had a number of governing bodies from different sports. We've had rugby partners. We've had civic partners, for example, the council and the museum. We've had a couple of private and commercial partners, We've had lots of academics, not just Loughborough, lots from international voices and domestic, and then a little bit of media and press. But classically, the point has always been, what's the hook, what's the story? And they don't really see convening and connecting as a juicy story, which I can't fathom, but there we go. But yes, all of this has been multi-sector. So what have our activities look like in numbers? So this is going to be a very busy table, but I will walk you through it. Thursday and Friday last week, when we hosted the summit, I've put there kind of approximately how many people we invited to how many people actually attended, and a couple of ways that people then did some online engagement. And then the Monday and Tuesday represent the stuff that we've done with the Institute of Advanced Studies. All of the Institute of Advanced Studies have been publicly disseminated, and sign-ups. Kieran has cultivated all of the tech so we can do it on Zoom and in person. And we've got a reasonable amount of people for those. And then we've had our survey out, which at the moment has had 19 responses. I'll pause there just to see if anybody's got any comments on either the amount of people they invited and how mad I am, or indeed anything else that jumps out from that. I think, Kelsey, when we were talking, you were surprised on a couple of those.
It's really hard for you to actually get it out there, because I work for International Federation, and I'd been really keen to get involved in some of the earlier stuff, but obviously just kind of hadn't heard about it. But I know obviously you've done all you can to get it out there, so I guess it's just that, especially because I live in Loughborough, it's that kind of like mismatch of how you get in touch with people that are interested. It is really difficult. So I know you've done everything you can, and it is difficult.
To an extent, like Kieran and I were literally speaking yesterday, is that we tried to summarize what we were doing and put it into a bulletin that goes to our sport park partners. But we don't think that necessarily has worked. So we've getting it into
sport parks, International Federation. So because I would have thought actually if they'd heard of it, I would have thought there'd be more people.
Yeah.
I don't know. It's really difficult.
Yeah, so we've kind of tried to do that word of mouth. If we put it into our, like, if your national federation is in sport park, they might send it on. But yeah, there's been a lot of to and fro in with who and what the right person is at the institution, let alone getting it into their hands. So yeah, no, it's a really valid point. We've really struggled with it. That's why we kind of, for the Thursday and Friday, went out to so many people. And Becky's nodding. There was a lot of invites that went out. I don't know if you get any PTSD, Becky, with how many emails you ended up in your inbox.
I think one thing I was impressed with is the variety of people you had there, and I think that's something that I'll try and replicate with our sports medicine group, of saying that you had such diversity. And I think to bring those people together, that enables the sporting bodies to have research done that they want done instead of what is in the, that might be interesting from a research point of view. But it also connects the researchers with the sporting bodies, and how you did that was make us work together. So that was really clever. Maybe another thing you do next time is make people move.
Yeah.
So therefore you met more people, because when you work together, that's how you got to know the people.
Yeah.
So I think that strategy is not a normal lecture style, style, which is like Katie and I were going, we're normally sitting there presentation after presentation after presentation. But to have such a diverse group together and make them problem solve and make them present what their issues are, was really clever. Hats off to you.
I think that's why I put LinkedIn on the online engagement, because the thing that shocked me was when I went onto my LinkedIn was just the amount of like conversations that we're having. It wasn't just posts to be like, great presentation, Deirdre. It was like, that was Deirdre, I said this to her, this is now happening. Like, we could see how the energy in the room had translated into some LinkedIn conversation as well, which is really cool. Thank you to everyone that promoted us on LinkedIn. Yeah, but I think it's a really challenging format to take on, and it doesn't get to all the right organisations. But I think we've learned a lot from this, just who's on our doorstep, as much as anything else. Any other comments or reflections from this busy table? So then what we've done, and what I'm going to sort of stimulate for the next part of this, which is the majority of today's session, is exactly what we've started to do in the room, is have conversations about lessons learned and the what next. And the way that we've done this as a group, so this survey is a collaboration between myself, Dr. Rebecca Grant, Dr. Samantha Rowland, who should be here imminently, and Dr. Hannah, who's online and prompting online. We're just going to use the questions that we've got in this map survey, which is still live, to stimulate some thinking in the room. And I'm going to share with you some of the provisional responses and observations that we've got from it. So the first thing that we've asked people to think about in the survey is what innovation is. Because even within Hannah, Sam, Becky and myself, we weren't all sure we were talking about the same thing when we said the word innovation. So in the original survey, we've got innovation involves developing creative solutions to address significant challenges. And then we ask people to share ideas or thoughts you have for innovation in women's sport. So I'm going to pause there for sort of 5 or so minutes to see if any of you have any reflections on how we actually did innovative things at the summit. So if you witnessed our proto hologram of our new director of sport, Louise Gear, then let me know if you enjoyed that or not. But equally, just sort of speak to that general question. What do you see in your own practices, your own research, your own experiences around innovation? And feel free to get up and move and chat with everyone in the room or continue to eat cake. For those online, Hannah is going to facilitate the online discussion. I'm looking at the owl. And there's my timer, so I will shush for 5 minutes. So to stimulate this a little bit more, I'm going to share with you what some of our survey sort of responses have been so far. So on this question that we posed in the survey, we've got 2 lovely and very different perspectives on what those innovations could be. I've turned it back on, don't worry.
Just checking.
Yeah, no worries. I forever make you nervous about tech. So yeah, just to carry on and wrap up your conversation in the next couple of moments, these are just some really lovely insights that we've had already. And we're not expecting one answer on this. It is genuinely just like, is innovation a good word? And if you've got any bright ideas, please write them down or post them, because we need many ideas on innovation at the moment. So just another couple of minutes on this and then we'll go on to the next one.
Actually, they don't. Oh, yeah. Elsewhere, you know, but
Okay, I'm going to bring us back together, both the virtual room and the in-person room. I kind of wandered around and listened to a couple of conversations. A number of people are kind of challenging us around innovation. Is ways of communicating, whether that's when communicating when you're in a group or communicating to get things out to invite people, or indeed once we've gathered all of our wonderful research, is how to then get it back out to the beneficiaries of this. So I think quite a lot of this is centering around communication, which we can absolutely keep tackling. The second thing that we've asked people in our survey is, from your experience, what are the biggest challenges to bringing new ideas or improvements to women's sports? So we've heard a lot about what we did kind of across the 2 days last week. If you haven't been part of those activities, we can share, but a lot of that has been focusing on what expertise you've got globally or at Loughborough or around the UK, and how that translates back into industry or perhaps doesn't. And then on the Friday, from the rugby perspective, you really kind of heard and saw what local partners needed versus what the rugby partners needed versus what the tournament was actually looking to try and achieve. So initially, from our survey, and I'll use these to help sort of stimulate your conversations for the next couple of minutes, we've had 3 responses that were really quite interesting. One, overcoming stereotypes. The next one is around flexibility, and I'll let you read that. And then the final one is around inclusion and relevance. So I'll leave you with this question and I'll give you again about 5 minutes online, 5 minutes in the room. Keep writing those ideas down or giving us some feedback on what we've been doing. From your experience, what are the biggest challenges to bringing new ideas or improvements to women's sports? So I'm going to change this one up, and rather than wandering around, I'm going to put someone on the spot. We've got a cracking comment in the Zoom channel if no one wants to share first. Anything from groups that sprung out around biggest challenges to bringing new ideas or improvements to women's sport?
Yeah. No, I was talking about it because for me, I'm coming from the Asian background, East Asian background. So we have some stereotypes that we cannot really openly talk about a lot of things. And we have to sometimes filter some words or what you have to say, because we cannot say in a really, not aggressive, but really in a strong way. So sometimes it's really hard to express what I'm thinking at the same time. And also it's kind of feeling scared whether this is right or wrong or in judgment as well. So sometimes I think it's a little hard in this sense.
Excellent point. Excellent point. For sure. For sure. It kind of speaks to one that we shared online. Have better representation in the rooms from different demographic backgrounds, not just age and childcare, but geography, racially, ethnically, socioeconomic perspectives. So yeah, completely amazing point. Anything else?
I guess
Yeah, go ahead.
bits of something I've just written down was around like for some women, it's almost the gender's not the biggest barrier. It might be kind of things like disability, living in a disadvantaged community, and it's all those kind of cross-cutting barriers. And it's kind of, and I guess being careful, it's not just say almost the women that are most advantaged generally in society that, you know, benefit more from this.
Yeah.
I think I've been involved in organisations and we come up with all of these barriers. So we come up with ideas and we come up with all these barriers, and then it all just seems too hard and we don't do anything. And I just go, that was a waste of time. So I think there almost needs to be this tiered approach. What change can we actively do something with now?
Yeah.
What's the next phase of where we need more resources to do this? So then we do, so we don't get to the end and do nothing.
Yeah.
And I feel like there's a lot of stagnation in it because we don't have a lot of resources in women's sport, that we don't get stuff done.
The thing that I've taken away from your presentation style, Deirdre, both on Thursday and today, is your use of like action plans and how particular groups you think are influential in your area can then take different actions. I think you've broken up those next steps in a way that's really clear. Whether people do them is a different matter, but your call to action has been really well actioned and segmented. So that's something I've learned from you about breaking this down and not paralysing ourselves if there's too much to do, for sure.
I think we become paralysed, and then there's a great initiative and a great bit of energy, and then nothing happens.
In our roadmap, there's a big hill to climb, and if we get to the top and then slip back down, it probably cause more harm than good.
But I think we need to make a level, like a step approach, and go, what can we actually do now?
Yeah.
And then really clearly collate what do we need in order to do the next step. So we know what we need, and so we're more likely to make it.
Definitely. Definitely. Anything else in the physical room? I'm just keeping half an eye on the virtual room.
I've just listed down communities of practice.
Yeah.
I think part of what's really worked over the last few days is that we've had a massive mix of people come together and just share. Like, this isn't academics telling you what to do or the right way to do it. It's actually an opportunity for us to go, what is actually the issue that you're worried about right now? Because we need that as well, but also to know the who's who and the what's what and what's gone wrong, and that's okay. is really valuable for
Yeah.
everyone, but in the same sense of how do we continue that forwards?
Yeah.
You know, it's great to do that again, and what are the opportunities to keep up? Because that's the difficult thing, right? How do you get everyone back together and keep sharing that experience to go, oh, how did you do with that? Or is that worthwhile?
Yeah.
I think that community of practice thing has impacted me, I suppose, from it's not something so normal for my area, but actually it's really important to the application of it, I think.
Thankfully, we have someone in the audience that specialises in participatory action research who can help us with those next steps. So thanks, Robin, for this through. I'm going to move us on because this is all awesome, and the next few slides just kind of keep layering in. So the next question that we posed, but bear in mind this is still live. What one thing should be at the top priority over the next year to improve spaces for innovation in women's sport? So it can be one thing that means something to you and the role you're in, because you've got a real diversity of roles in the room. It could be a priority that you've been working on for 20 years and you just think now is the absolute time this needs to happen. Or it could just be kind of the example that Becky was just riffing off, like what do those spaces look like? Is it just a case of staying connected, and what does that look like? So please interpret this question that is really relevant to your role and context. And again, online and in the room, take a few moments to think that through. When we've posed this to our current survey respondents, they've asked for greater inclusion, more access, and then there is a really interesting point around digital tools, just to put digital in there. So yeah, I'll leave that with you to read and discuss, and we'll come back in about 4 or 5 minutes just so we can make sure we end on time and people don't get stuck too much in traffic. Okay, so again, I'll just bring the room back together. Apologies, you're like full below. Kelsey, Emma, Esther, anything from your table that like jumped out in this?
I think that one of the things we talked about was, getting women together in the same way, or rather getting people together in the same way that we have done here from grassroots up to policymakers and everything in between, and we're talking about
Yes,
make a difference together.
Yeah, and in different spaces and places, what we've done here could be lifted into any institution, any place. Yeah, really good point. Anything else that's jumped out? Marvellous. I will keep us going because we've got a few more bits for you to discuss. The next thing we've asked, you can see how the layering's kind of working, is please rank the following research and innovation areas based on how important you think they are for the future of women's sport. So this is like a game show. No, this will not be graded, and you will see from the next slide on how the provisional sort of the data that's coming is. The options we've given to people, we've not said to people put this is the highest priority all the way to the lowest priority, because that would be super unfair. Instead, what we've said is rank them using a like scale. So extremely important, very important, moderately, slightly, not at all important. So yeah, we're not asking for you to tell us that data research is your least favourite thing in life. But yes, and we do have a bit more brief on the survey, but they're kind of self-explanatory. Again, I'll give you kind of 4 or 5 minutes in tables to attempt to rank, or just share what perhaps you think is your most extremely important topic. And then on the next slide, you can see if it marries up with a couple of responses that we've had so far. Hannah on the online room, I definitely want to see your written out ranking, because I'm intrigued to see if it matches with mine. I'll do the same. Okay, so I'm not going to cruelly ask and go around and start to say, no, my letter's better than yours. We have had a really interesting online conversation. First of all, I put Hannah on the spot to give her most important one. She's like, well, it's not anonymous. As I know. And I should say the survey can be kept anonymous, but we do ask at the end if you want to stay in touch. But then Professor Catherine Rizzoni, who spoke on Thursday and Friday at our summit, has given a really lovely, of course, well thought through answer. And what I really enjoyed at the end of it is she said that the reason why she's given the extremely importance or very importance is because of her clinician perspective. And if A is done well, the others kind of go underneath it in a great way. So again, it kind of depends where you're coming from. If you're a social scientist, a clinician, if you work in an international federation, if you're a doctoral researcher, if you're a marketing manager, if you're a translational scientist, you kind of, depending on your gaze, I would expect this to be different. So far, F is being ranked as our most extremely important, which is the social and cultural inclusion. And I think that speaks to a lot of the points that's been raised so far around, regardless of what we're prioritising, regardless of what we're doing, regardless of what our innovation looks like, it must not just be white women looking at white women, providing impact for white women. That's something that's come through really strongly for me this past few days. So yeah, social and cultural inclusion is huge in many different ways. Anything jump out to you in that very terrible graph? You can tell I'm not a quantitative specialist.
One of our reflections was around language, especially for A, if we're thinking about athlete health and well-being, are we talking about elite athletes only, or we focus more broadly on exercising, you know, women and girls?
And then you need F, yeah, okay. And then we need the previous answer of it being the whole spectrum. I agree. I think at the moment, especially at sort of the national governing body, international federation, governmental levels, it is athlete health and well-being. But maybe as that is one of the things, first things on the roadmap is language. Should it just be women, girls?
Whatever, women and girls, whatever, but I think
Movement.
it's very exclusive.
Yeah, very exclusive.
If you're a recreationally active woman, you're looking at that already like, well, that's not me. Well, it is you actually, but we can say, you know, it doesn't feel like.
And at Loughborough Sport, it's a female athlete health group. So again, athletes. So yeah, we absolutely need to think about what these groups are called, what we're saying. I completely agree. And quite a simple action to take on.
Yeah, and that was one of the things we talked about, that from a local sport perspective, you know, our athlete health and wellbeing is extremely important to us.
Yeah.
But if we don't widen that, and you know, one of the things we talked about was the fact that if we don't focus on those young girls, are they getting in the amount of dropout that you get in that kind of early teenage years? Are they getting the opportunity to become an elite athlete? Because actually they've dropped out because they're not comfortable with the clothes they're wearing or dealing with certain stages in their lives. So there's loads of different things that stop people actually getting to that elite athlete point.
Thankfully, the person that can solve that has just walked through.
So sorry, I'm tired.
You don't need to follow at all. I've been trying to constantly be like, and Sam will solve this. Sam will do this.
We're just pushing it way too far now.
So I've typed up all the actions and I've just listed your initials by them all. 'Cause- yeah. Okay. No, Kelsey's been subbing in for you. What we've been doing is just going through each of the survey questions and kind of thinking through the what next. And we've had some really interesting conversations. Again, diversity of thinking. We've got Katie Rizzoni and Hannah on the online chat, absolutely making some killer points. And I think Hannah and Katie have put in a couple of more comments about also the need for data and research, but to be really mindful that data and data collection and research at the moment, funding is very scarce, whether you're in the States, Australia, the UK setting. So we also need to be really mindful about not doing too much blue sky thinking because it all costs money, hence the business of women's health. Okay, what now? So what, who, how? Let's do that in 11 minutes. I'm only joking. What I want us to focus on for this really, really final part is what are the opportunities? So yes, we've got some fantastic ideas. Yes, we have some huge weaknesses in our systems and ability to do them, but really let's focus in on our strengths and opportunities. Let's end on a high and a positive. And for innovation, I've started you off with a bit of a list and what needs to be on our roadmap. So where are we going to get this funding from? What did the partnerships look like? Who is collaborating and how? What does dissemination and translation mean across different beneficiary groups? What is impact? Education. This seems to be throughout everything we've discussed the past few days, and we've used the C word a lot. What does communication in the coming months and years look like in this space? Again, not asking you to do anything massive in the next 10 minutes, but perhaps take the next 5 minutes or so, again, on your sheets of paper or just discussing it, or in our fabulous online forum. What stands out to you on this list as some of the what next? Have we missed anything? what would be your one big thing we should focus in on, and any things up in the air? Perfect. And if it's a funding grant, I'll write it. Okay, I'm gonna just timing wise, because you'll have time afterwards to continue some of these conversations. I'm gonna bring us back. So I think in the digital chat, we've been talking about funding and being creative about funding opportunities, creative about bringing people together or putting a female or women and girls aspect into an existing bid, which is a good point. And then we've also had a really good point raised about using people that have already had successes. So for example, Deirdre, in your dissemination work, and showing that to some of our doctoral researchers, some of our early career or mid-career researchers, or indeed the partners we had in the room, to show what's possible and can be built out on. So some really nice takeaways. Any reflections in the room? Oh, and Chloe's put something in as well. Thank you, Chloe. Sam, your table, anything that jumped out from that list or otherwise?
We spoke quite a bit around education, and that's been like a key theme that's come out time and time again over the last kind of week or so. And then it's how do you actually go about doing that education? Talk about school teachers and their capacity to take on extra things is limited. Coaches are largely volunteers, so
yeah,
when are they supposed to do that? And then talking right through to the elite athlete side, their schedule is so packed already.
Yeah.
When do they actually fit in another CPD session or workshop? So yeah, the challenge around actually implementing that education.
I think the non-full-time, non-paid workforce point is incredibly important. That is absolutely something we need to think through for sure. Robin, your table, anything jump out? Sorry, I've done that as your mid-writing post-it.
No, so yeah, we had some good conversations. I think especially in terms of thinking around how we can get collaborative when it comes to funding. Obviously the landscape's not great in the UK at the moment, so we talked about, you know, working with collaborators overseas, accessing different pots of funding, thinking about collaborations with industry partners. I know that came up on Thursday afternoon with the folks from the Tucker Centre.
Yeah.
Thinking around actually creating spaces as well as funding opportunities to support research development across disciplines, as well as with diverse stakeholders. So, you know, the need for, you know, small pots of sequel funding and actually, you know, to actually be able to kind of support that collaboration right from the outset.
And I actually think the pots of money that funded everything the past week have come from all of these, maybe less so philanthropy and enterprise, but we've had value in kind, consultancy, grant money. So yeah, this whole thing was funded by diverse pots. Don't think there's a magic pot at Loughborough. Crashing that perception down, Kelsey. Oh yeah, of course, Reese. Yeah, go ahead.
Obviously we've spoken about like giving the education to the doctoral researchers, but also within, I know for example from the South Coast Doctoral Training Partnership, we have now from the first year like research and practice. So we have to take
research impactors. Okay.
So we have to take 3 months away from our PhD. We're not allowed to do any data collection. Work on the PhD, we have to work in industry, consult in something. And it's so difficult to convince people to take us, even though they don't have to pay us, because we're being funded. So take some of your doctoral researchers in the DTP and use them.
Okay. Yeah, we'll definitely come and pick your brains about that for sure. Yeah. Awesome. Really good point. Anyone stable?
I guess something I was just asking about, like whether it's discussed on Thursday and Friday, was I guess something that I guess it's just something very like we're a big issue for us at the moment. It's around like kind of transgender inclusion, and how that fits into the whole piece. And I guess kind of making sure, making sure kind of people have the right opportunities at the elite and the recreational. I guess it's just kind of just getting it, trying to find a way of getting it right to include and not exclude as many people as possible, but making it fair at the same time.
Yeah, really, really valuable point. And one thing that we've done the past week or so is allowed all topics to be brought up. So whether it's from the most polarizing, for example, transgender inclusion or concussion in women's sport, or whether you should wear breast protection or not, right the way through to the topics that we're really comfortable to talk about. So I think it's really important that we allow those spaces for any of those topics to be discussed. We can't guarantee that we have the research and innovation that can provide all the answers, but we sure as heck can provide a space where you can safely discuss it, absolutely. A couple of our colleagues were here yesterday from sport management that do a lot around policy around transgender and inclusion. So if you want to connect after, I can put you in touch. Yeah, I'm not diplomatic passing the book. They just actually published on this topic.
No, that's something it's been in our organisation, I guess the last week, that's been, sort of a
Oh,
very
of course,
issue on our
yeah.
sorry, it's just,
You don't need to apologise. At the beginning of the summer, when Emma and I took part in the radio broadcast, the topic that came up was very driven by the news cycle at the time, and it was all about online abuse in women's sport. So actually, I reflected after the fact that I wasn't the right academic in the room because I didn't have any research and innovation on that. So no, we have to be led by what's most important in the press or the wider societal things as much as what we think is important, for sure. So no, really valuable. Thank you. Great point, Chloe. Thank you. Lots of stuff happening in the online chat, thankfully. I'm very mindful of time. So this is just a plug. Our survey is still live. We're going to collect probably into the autumn, because the more people that sort of tell us what they're thinking or have ideas, the more we can begin to sort of pull this together. And all of this is being driven by being built on partnerships. So just a massive thank you again and acknowledgements to the amount of partners that have brought this week together. And a huge thank you to everyone in the room, your generosity of sharing your ideas, but your willingness to come this afternoon. For those of you in the virtual room, I apologise because this isn't relevant, but for those of you in the physical room, there's loads of cake and delicious sandwiches and little bits of water and everything. So please either grab some and continue chatting and networking, look at our exhibition, or indeed please get on to your merry way. For those of you in the virtual room, a massive thank you for joining for wherever you are. There's plenty of ways to stay in touch, whether it's with individual academics or via our research and innovation hub here at Loughborough. And just a huge thank you and a massive round of applause.
Thank you for listening to the podcast of Loughborough University's Institute of Advanced Studies. A quick reminder about how to stay connected. You can find us on Blue Sky, LinkedIn and Instagram, and you can also watch the presentations on YouTube. The podcast is available on all the major platforms. Please download, share, and most importantly, subscribe. See you next time.